Joining us now from the nation's capital is Representative Phil Rowe, the congressman representing Tennessee's 1st Congressional District. Congressman, thank you very much for joining us. You're actually a perfect person to have on for this topic. You have an extensive resume when it comes to the issue of just healthcare, medical type of situations. You're a physician. You're the chair of the GOP's Doctors Caucus, Congressional Academic Medicine Caucus, Healthcare Task Force. I could keep going on. But I just want to start by asking you right off the top, is the U.S. prepared for the coronavirus outbreak to make its way here to the U.S.?
I think we are. I think we're as prepared as we can be, and really it goes back to 9/11. After 9/11, we worried about, at that point in time, about smallpox, and I and many of my colleagues went down and got re-immunized, and the Department of Homeland Security was created, and really a lot of good preparedness occurred out of that. And right now, I think we're preparing as best we can, as we've seen what's happened in China. I look at myself, I'm an old 2nd Infantry Division guy. We planned and trained for these types of things. Our country will do well with this, as well as can be expected by any other country in the world, I think.
And I think it's important, too, for viewers to kind of move forward and kind of know that when it comes to these type of situations, they're very much so fluid. A lot of times they are played out in the media a lot. That's not to downplay the seriousness, or the potential seriousness, I should say, of such an action. But I also want to take more a look at action more than the words that are being said about it. We've seen the Trump administration propose about $2 billion put forward to help kind of prevent the coronavirus outbreak here in the U.S. That was actually kind of shut down by critics. They say that that wasn't enough. Do you think that funding should be allowed to go through? Do you think it's at least a first step? What do you think should be done as far as funding goes?
Absolutely. It's one of the silliest arguments I've ever heard in my life. We're going to provide what's needed for the American people, whatever it is. So the first step, you couldn't spend $3,000 million, which is what $3 billion is, in a week if we tried. And so what you've got, the experts feel like they have the money they need at the burn rate they need. And just like we do for other emergencies, whether it's a hurricane or whatever, if whatever resources we need, that's a silly argument. It's a false flag. We will provide, the Congress will provide the country what it needs, resources it needs, the products it needs to protect itself.
And I don't like dealing in hypotheticals, but we see situations in Italy, Iran, South Korea, Japan right now, where the coronavirus is spreading at a very rapid rate. China seems to at least a little bit get it under control right now, but they've taken almost dystopian-like restrictions. We've seen the U.S. impose some travel restrictions right now, but if the virus were to continue spreading at the rate it has in other countries that I just named, what would be the next steps by the government?
You know, I think one of the things we've done that's done very well in this country, remember, China has a very centralized system, whereas if you need to go see a doctor, you go to the hospital. We have a very decentralized system in this country, where if you're very sick, you go to the hospital, but for other minor ailments, you go to a walk-in clinic, to your doctor's office, to those types of things. So, and we have health departments in this country. Every county in my state has a county health department. So we have a way to decentralize. It's much different than it is. And I was talking to one of my doctor colleagues today at a VA meeting, and he said that it was a young student had come back from Italy into France, and so in France they quarantined him, except they gave him a chit to go out to have dinner in a restaurant that night, which makes no sense whatsoever. We know the things to do, and we will do those things. If it's letting school out, which we've done in my district already, we've had just the seasonal flu have closed several school systems in my district. And remember, I want folks to understand this, that many people don't get very sick at all. I have 2 friends on the cruise ship, the Diamond Princess in Japan. One, the wife was corona positive. The husband was negative. She has no symptoms whatsoever. She's been in the hospital now for a week, and has then had a negative test and had another positive test. So I think many people never go to the doctor. They have a minor symptoms and never have anything. Some people, the older you get, the disease is more serious. And as you pointed out in your show earlier, as I was listening, for whatever reason, and those reasons you gave were probably solid, children don't seem to be affected as much.
Yeah, and I think that is something that is kind of interesting, is that this is very much so a developing type of situation. Doctors are still kind of looking to see how it's necessarily spread, and there's still a little bit of a debate as to the origin of it. But before I let you go, too, I know that you have been a very vocal advocate for a more free market type of healthcare system here in the United States, specifically kind of issuing a counter to the Affordable Care Act. And now we see a time right now where a lot of Democratic presidential candidates are asking for a more expanded role of the government when it comes to healthcare. How would that system hold up in an outbreak situation such as we're experiencing right now?
Well, I think we're seeing it in China right now. It's not well. And a decentralized system, a free market system, can react much more quickly. In a situation like this where you may have an epidemic proportions, you need both government to supply things and the private sector to supply things. So it's a symbiotic relationship. I think our system in this country will be better prepared than anywhere. Let me tell you what was amazing. In 42 short days, already sent to the FDA for testing, for biologic testing, is a vaccine. That's unheard of. You would never see that in a socialist-run system. You only see that in the private sector. In 42 short days, testing has already started for a vaccine. So I think certainly our system is better, much better equipped than the public systems are, without a doubt.
Yeah, I mean, a lot of people are hoping so, and I guess I hope it doesn't come to the point where you have to put it to the test, but a lot of advocates of what you're saying right now are saying the exact same thing, that even when it doesn't come to care, the innovation provided by the private sector is still very much so an important thing. We heard it from Health and Human Services Secretary Alex Azar the other day, saying that the private sector needs to be playing a role in this as well. So it'll be interesting to see how they do that moving forward. Congressman, thank you very much for joining us tonight.
Thanks for having me.